Welcome to Sabra Says. I'm Dr. Madsen, licensed psychologist with over 30 years of experience bringing psychology insights to you. Today, I'm going to talk a little bit about cognitive behavioral therapy, what it is, and kind of what to expect if you've been referred by, say, your primary care physician for CBT therapy, which is cognitive behavioral therapy. So, a little history, I think, is needed to begin with. Prior to cognitive behavioral therapy, the main area of therapy was psychodynamic or psychoanalysis is what some people are familiar with. This is the type of therapy that's often depicted in movies and cartoons where somebody will be laying on a couch and the therapist will be kind of like sitting behind them taking notes and saying, very well, very good. And it was used for a long time and it had its effectiveness. And the philosophy behind psychoanalysis is still very much alive today, and therapists definitely use a lot of that theory in their practice. However, in the 1960s, late 1960s, early 1970s, Dr. Beck, developed what we now know of as CBT or cognitive behavioral therapy. And he developed it because he noticed that there was a connection between people's negative thinking and depression. So he developed this type of therapy. They did a lot of extensive research and it showed that it was effective. So one of the biggest differences between psychoanalysis and CBT is the research backing it up. So the research with CBT showed that it was effective in reducing depression, and now it's been shown to be very effective with a lot of different types of psychological conditions. But more importantly, almost, was that it's much more time effective. So with psychoanalysis, people would be going to therapy sometimes, 3 days a week to 5 days a week to see their therapist for 1 or 2 hour sessions. They were spending a lot of time there, and there wasn't a whole lot of research to show its effectiveness in actually reducing depression or anxiety. It was more insight focused, and it definitely has its values. It's not that it's not effective or important. It's just the research shows that CBT has more effectiveness in a shorter period of time. And the people who really liked this finding were the insurance companies, because if somebody's in treatment for less amount of time, it's cost saving. So the business side of medicine kind of got a hold of this and, really advocated for CBT. And at this point, I think it is the most well-respected type of therapy. So if you go to your primary care doctor and you say that, you're having some difficulties emotionally, they identify you as needing treatment, most likely they'll refer you for CBT treatment. So then that leads you to the next step of getting that help. So you may go on Psychology Today or look on Google, ask around friends, somebody, maybe your doctor refers you to somebody and you tell them, I need CBT treatment. And I would say just be a little bit careful with this, because there are a lot of therapists out there that claim to do CBT. And in fairness, they do aspects of CBT. Some of them might have had a class, maybe even like a weekend kind of certification, continuing education in CBT. But unless they graduated from a master's or doctorate level program that really, identifies as, teaching CBT, you might not get the full experience. So what is the difference? If you're not getting the full experience with your therapist, when you're in therapy, it's going to feel more process oriented. You're going to, talk about what's going on, and they may guide you through some questions that involve some cognitive behavioral therapy, but true cognitive behavioral therapy is very structured. You have homework. And you do a lot of working on worksheets and working on that with your therapist in session. So if you're not getting homework, if you're not getting handouts, you're not logging, and it's not very structured, then most likely you're not doing what we consider to be formal cognitive behavioral therapy. So if you are referred by your doctor or somebody, or you're just looking for it yourself, be sure to ask when you call in, is that therapist truly trained, in traditional cognitive behavioral therapy? Before you start, if that is what you're looking for. It's not what everybody's looking for. It requires some commitment. It's work. You get homework. So if not everybody wants that, and that's fine, but if that's what you want, be sure to specifically, ask for that. So what is cognitive behavioral therapy? Basically, the basic premise behind it is that your thoughts lead to your feelings, which then lead to your behaviors. So that there's a connection, that your feelings and your behaviors aren't kind of like popping in your head out of nowhere. You're not behaving just totally impulsively, that there is something going on in your brain cognitively prior to those feelings, or simultaneously, and then those behaviors. And then also there are core beliefs kind of driving all of that. Okay. So with cognitive behavioral therapy, you're going to learn about different types of distorted thinking. What kinds of thoughts lead to distorted or distress in emotions. Okay, so say, for example, all or nothing thinking, where you tend to look at if this, then that, and you neglect kind of like that middle area of possibility that leads you to jumping to conclusions, getting very anxious, and then behaving impulsively. So you learn all the different kinds of distortions. The most 80% of it is becoming self-aware. Like when you're not in session necessarily, but when you're out in the world, of being aware of when you're having these thoughts, and stopping for a moment, identifying how it's distorted, and then logging it out, meeting with your therapist, and developing alternative thoughts that are based more in reality and are more rational, that will then lead to less distress. It is a process. It is work. It does not happen overnight. Just because you learn your distortions doesn't mean that, you're going to be able to go out there and identify it right away and magically get better right away. It's work. And, we have setbacks too. Sometimes people are doing really well with it, and then they, have a really stressful event, and we have setbacks, but often in hindsight, we can kind of see what happened there. So you have your thoughts, your feelings, and behaviors. Core beliefs are the deeper level beliefs that we develop usually in childhood. The core beliefs that tend to give people the most trouble are feelings of low worth, feeling unworthy, feeling inadequate, feeling like a failure, and fear of abandonment is another big one. So people, with trauma, or, grew up with abusive parents that were very critical, will often have problems with fear of failure. Certain personality types, struggle with different core beliefs, but we generally, as people, walk around kind of unaware that we have these core beliefs, and we defend against them because they're really upsetting. So nobody wants to believe that they think that they're a failure, so it's very well defended, and those people may actually behave in a way that looks a little overconfident when, they're kind of overcompensating for something that they don't even realize is there. So the beauty of therapy is the ability to be in a safe environment with somebody where you can kind of dig into that and figure out what's driving these automatic thoughts that are causing so much distress, and healing some of that a little bit. Core beliefs don't ever go away completely, at least not in my opinion. I think we're kind of stuck with them to a certain degree, but they don't have to impact us to such a high severity, and we can improve our recovery time. So, we may have a moment where it stings for a minute, but then we can kind of work ourselves through it. And that's what therapy does for you. It doesn't cure everything, but it increases your awareness. It increases your ability to cope in those situations, not get so upset, and recover in a quicker manner. So in my experience, both my master's and doctorate programs were very heavy in CBT. I personally love it. I enjoy doing the work with people, but it is work, and I give homework, and sometimes they don't do it, and it's not the end of the world. It's not like school where you get yelled at or anything if you don't do your homework. But if you don't do the work in between sessions, then basically you're in therapy a little bit longer, because then we're going to be doing the work in session, and it's fine. Sometimes people's lives are just too chaotic, and they just have too much going on, so we kind of just meet people where they're at, without judgment, and just help them through it. So that's a little bit of background about cognitive behavioral therapy. I hope that it was informative for you. If you're thinking about going into therapy, now you know a little bit more about what to expect. A little bit more about what you want. Maybe you want that or you don't, so you can advocate better for yourself. And I hope if you do decide to start therapy and do CBT, that it's a life-changing thing for you, like it has been for myself and a lot of my patients. All right, so if any of you are interested in therapy, I always advocate for Psychology Today. I'm not sponsored. I like the platform. I think it's a great way to find a therapist. So if you are interested, Psychology Today is a great place. Otherwise, take care and be kind to yourself.